Welcome to This Week in Hearing. World Hearing Day 2023 is upon us, and we are fortunate to have Dr. Shelly Chadha join us today to discuss the World Health Organization's awareness campaign on deafness and hearing impairment, as well as discuss her thoughts on ear and hearing health on a global scale. For our audience, Shelly, would you kindly tell us about you and your role at the World Health Organization?
Thanks, Amyn. Thanks for that question, and a pleasure to join you here today. And hello to all the viewers and listeners. So I am Shelly Chadha, as you mentioned, and I'm the technical lead for ear and hearing care at the World Health Organization. In terms of background, so I come from India, and I am an otolaryngologist, an ear, nose, throat specialist. I spent the first half of my career working with patients in one of the largest hospitals in northern India, and also teaching students as a professor of otolaryngology. But then I also did a PhD in public health, and the second half of my career up to now has been spent really on integrating these two aspects. So that is hearing health in terms of clinical hearing health, but then applying those principles to public health, or applying the principles of public health to making hearing health accessible. And that's essentially what I do at the World Health Organization. I lead the program on hearing care that aims that everybody in the world should have access to hearing care, to services that they require to prevent, identify, or address their hearing loss.
Well, we are certainly fortunate to have you and your leadership and many of the tools and information that comes out from the World Health Organization under your leadership has really been fabulous. One of the things that I think has really not been defined well within our area is the fact that hearing loss is a public health issue. Can you talk a little bit about that, please?
Sure. So let me start by giving you some facts and figures. The fact is, currently there are about 1.5 billion people who have hearing loss of some intensity. It could be mild, it could be profound, so across the range. Majority of them, of course, have mild hearing loss. But if we look at those who have moderately severe or a moderate or higher severity of hearing loss, people whom we estimate require hearing care services, that number is nearly touching 500 million now. And the vast majority of them live in low and middle income countries of the world, where services for ear and hearing care are commonly lacking, where human resources are commonly lacking. What we also know now is that these numbers are rising. By the year 2050, we estimate that over 700 million people would require ear and hearing care services. And there would be many, many more who have mild hearing loss, but at the moment we are focusing really on those who have moderate or higher severity of hearing loss. So that's going to be 700 million. And while this rise is driven by demographic factors to a great extent, there will be more people in the world, more older people, but it's also that risk factors for hearing loss are persisting and increasing. So risk factors such as exposure to loud sounds, exposure to noise, on occupational settings, but then also in recreational settings increasingly so. Also, common ear infections, which are extremely common especially in low and middle income countries of the world, these continue to affect millions of people across the world. And these are conditions which can be prevented, they can be treated, so that the hearing loss that is associated with them, that can be mitigated. So that's just to give you the problem. The fact is, we have all of the solutions. In the field of hearing, we have clinical interventions, surgical interventions, we have technologies that can identify hearing loss in any age group, in any setting, community setting, clinical setting, whatever. And we also have the solutions to address hearing loss through interventions, through technology, through use of hearing devices, use of various rehabilitative measures. But currently, what WHO estimates is that only 17% of those who are in need of these services actually are accessing these services. So that's a gap of over 80%. And this gap is high across the board. It's high in low-income countries, of course, where it is about 90%, but it's also as high as about 75% in high-income countries. So that's just to say that that is the extent of problem. So we have this challenge, we have solutions, but to make sure that the benefit of the solutions reaches this 80% or above that it is missing, we need a public health approach. And that's why it is a public health issue, and that's why we need to work at it from WHO.
Well, you brought up a really important point, and that is the fact of accessibility. And accessibility is a supply side issue. So are we looking at a supply side issue in terms of not enough providers, or are we looking at an accessibility aspect in terms of the demand can't reach the providers because they don't have access, or is it a combination of both?
So I would say it's more than that, because I wouldn't put it as only a supply issue. I look at it more as a demand and supply issue. And I'll explain why. So as we see it from a public health perspective, there are, if we drill down all of the barriers that we think restrict the growth of this field, we can kind of summarize them into two blocks. On one side is the awareness challenge, the lack of awareness about the importance of hearing, about prevention of hearing loss, or about the need to provide hearing care and so on. So there is this lack of awareness at all levels, whether it is policymakers or at the level of even healthcare professionals at times, and also at the level of the community, the wider community. And this raises the demand issue because the need is there. We see from the numbers that the need is there. But what is not coming from the community is the demand. And then, of course, there is the supply issue. The supply issue because, of course, we have a lack of human resources. So in 2021, we launched the World Report on Hearing. It gives a lot of detail on human resource availability. And we'll see, you can just take a glance at some of the maps which are there and look at the paucity of human resources for hearing care. ENT specialists or audiologists or speech language pathologists or teachers for deaf and so on and so forth across the world. So there is also the issue of lack of human resources, but then also lack of financial resources to provide training, also lack of equipment or capacity within the healthcare institutions to provide services to people. So the two are not distinct from each other in the sense that they are interlinked. We know that from the business model that demand drives the supply. And that's why it's really important to focus on raising awareness and drive that demand, which can also stimulate the supply. But it's not enough to just drive demand, because we can't just create a demand and not have the answer, not have the services available for people. So while we raise awareness on one hand, we have to also complement that with increasing the human resources that are available to provide hearing care and deliver those services to the people who are in need for them.
Yeah, you bring up an interesting point, and that is that, okay, we have this supply and demand issue, but we also have this gap. Now, in the U.S., as you know, we just had the final ruling and approval for the over-the-counter hearing aid component.
Right.
Do you think that is something that will eventually be accepted worldwide and globally, depending, of course, it's very early in this process, depending on how we formulate the policies that dictate the use, the application, and the outcomes from this particular new regulation that's come out?
Yeah, certainly. I think that regulation or legislation from the US has a lot of potential, firstly, to improve access to hearing care within the country. Secondly, I would say is driving the market. So driving a shift in the market in how the hearing aid service delivery is currently being done, who is developing these aids, who is buying them, and how they are being provided. So I think the other is the influence it's going to have on the entire hearing industry or the market related to hearing services. And of course, the third is adoption by other countries. And I think there are many factors influence the adoption. What we have to be cognizant of is that while on one hand, it is good to have the OTC devices, but it must also be accompanied by the regulatory kind of provisions that ensure safety of those devices, quality of those devices, so that the consumer at the end of the chain is benefiting from it and is not in any way going to be harmed. So wherever this policy is further applied, implemented, or adopted, we need to make sure, or the countries need to make sure, that it is done in a way that is well regulated, as it has been done in the United States. So, yeah, but I see that, like I said, the implications of this would be wider than simply improving access to hearing care in the US or driving policy change in other countries. I think the main impact of this would be to driving a shift in the market of hearing industry.
That's fascinating, and I appreciate your commentary there. So let's turn back to World Hearing Day, since that's coming up here in a week or so. And if you can just tell us a little bit about what World Hearing Day is. As you and I were talking before we began this session, it's actually been around for over a decade now. Started in 2012, and once we get into this, I think there are opportunities for individuals to take these awareness campaigns, as you talk about, and use them locally. That would then benefit them, increase that demand, and allow them to meet the supply, meet the demand in those areas.
Yeah. So the World Hearing Day is really our annual advocacy event, where we want to bring evidence-based messages that are well developed by WHO. So we spend a lot of time developing the data, developing the information that informs these messages, and then also by packaging it in a way that is those messages can be used by our partners in the field. So whether that is people working in countries or within the WHO realm or the WHO universe, but also anybody. It could be used by any individual. It could be used by journals, publications, as well as by NGOs, big and small, working in the communities. So the idea is that we bring these messages, evidence-based messages, which on one hand, so usually we always have a dual purpose. So on one hand, this is our day to raise awareness within the community to try and bridge that gap. When I say the community, I mean the general population. So bring those messages about simple things like how to protect your hearing or why to protect it, about ear care, so what to do, what not to do, simple tips, or how to check your hearing, or when to suspect hearing loss, or what to do if you suspect hearing loss, and things like that. But then the second target of this day are really policymakers. So because we also want to use this day to sensitize them to the need and the importance of paying attention to hearing care and to integrating it as part of national health services and national health systems, not just at the tertiary level, or at the level of very specialized services, or even at the secondary level of care, but really to integrate it starting across the continuum of care. So starting from primary health services and in all age groups. So for children, for adults, or older adults. So the focus is twofold. On one hand, to raise awareness within the communities, and on the other hand, to raise awareness with policymakers. So if you look at the World Hearing Day and our materials, you would usually find them structured like that. We have infographics with a lot of data, information, strategies, and so on and so forth. The target of which are policymakers, and our partners, people who observe the day, are the ones who take these messages, organize events with policymakers within their countries, within their regions, and so on, to bring the messages to them. And the second target is really the population at large, to whom we reach out through our WHO social media channels, but also very importantly, through our collaborators who work within communities in different countries across the world.
Yes, you're talking about collaborations, and as I was looking through the website, I noticed that the World Health Organization for World Hearing Day invites applicants for funding opportunities. Can you talk a little bit about that for those individuals who might be interested in something like this?
Sure. So, like I said, the purpose of World Hearing Day is really to use this day, one day, to create noise, well, pun intended there, about hearing across the world. And we encourage our partners to reach out to whichever section of the society they can reach out to, and to support some of them in planning their outreach activities. It may be in the form of an advocacy event or an awareness raising event. Could be a screening program or a school, kind of hearing camp or something like that. It varies. We ask people that if they need support, we can offer a very small support to them. These are grants of $800, so that's why it's called small grant, because that is what the amount is. But it does go a little bit of the way, and in some places a longer way than others, to support the organizations. This grant is actually being provided. These grants are actually being provided not by WHO directly, but by another partner that we have, the Coalition for Global Hearing Health. So the coalition provides these grants, and WHO is one of the contributors to this grant that is provided. But it's really, the purpose is simply to provide some support to those partners who are planning their awareness or advocacy activities and who want to apply and get some support. There is an application process and then an evaluation process. And this is all available online. So for this year, the small grants is closed, but we usually do it every year. So it will come around again next year.
Well, thank you for sharing that information. And as you pointed out, the amount may not be large, but even a small amount will help, particularly if you're doing some sort of a community awareness, or if you're in for example, a third world country. It may provide transportation or meals or something like that for those individuals who are participating. So thank you for sharing that. One thing that I've always wondered, so I'll ask selfishly here from my perspective, is, we've noticed over the last couple of decades or so that the ear has become more of a point of discussion as it relates to overall health. At the World Health Organization, have you seen perhaps that the hearing health component has taken more of a step towards the top of priorities for global overall health?
So the short answer to your question, of course, is yes, indeed, this is so. I think there are multiple factors which are driving this. Firstly, of course, is the growing need, but more than the growing need, it is the realization of the growing need. And this is due to data which is, of course, on one hand published by the WHO, but then also published by others like the Global Burden of Disease Study. So it is the realization of the high need. I think it has also been the fact that we have been able in this field to provide all the clinical solutions. We have the possibility to address hearing loss of any degree, where people, we also have the possibility for people to learn sign language and communicate through that, but also of hearing aids and implants and so on and so forth. And the demonstrated success of these outcomes is what is really responsible for bringing this into the limelight, so to say. So that is just to say what could be driving this increasing awareness, but how we evidence it through the fact that in recent years, in 2017 actually, and the couple of years preceding that, the countries, at the World Health Organization, we are a UN body, and all of the countries that are members of the United Nations, they're also members of the WHO, and their ministries of health, the ministers of health, secretaries of health, they're the ones who sit on the board and in the World Health Assembly, which is the decision-making body. So over 2015 to 2017, what we saw was this increasingly the questions being asked by countries regarding what is WHO doing about it, and asking for the extent of the problem and so on. And this then led to a resolution being adopted by the World Health Assembly in 2017, which called really for action on ear and hearing care, asking also WHO to do certain actions and also outlining steps which countries need to take. So that has really been, that is sort of the evidence for saying that this is moving up the ladder of priorities for sure. I think the fact that we have in the recent years have had some fantastic publications and are expecting to get more, like the Lancet Commission on Hearing. There is a Lancet Commission on Hearing, and we expect to have the report of that later this year. So these are also developments which show that this is increasingly being accepted as a public health priority.
One of the things that we are wrestling with here in the States is, we have and we talked a little bit about this, we have a shortage of providers. And the question becomes, should hearing care only be provided by ENTs and audiologists? Should we actually consider reaching out and extending, if you will, an olive branch to other communities? You pointed out speech language pathologist earlier as a possibility, hearing aid specialist or hearing instrument specialist. Do you think in order to meet the needs of these individuals and meet the demand, that should be something that we as a community need to embrace?
Absolutely. Again, short answer, absolutely yes, because there is no way that the handful of ENT specialists or audiologists or even speech language pathologists are going to address the needs of millions and hundreds of millions of people. So this is something that WHO is very, very clear about. And in the World Report on Hearing that I mentioned earlier, we outline, like I said, the availability. We map the availability of human resources. And we also show through this report and linked publications, what would it cost? How many doctors or audiologists would we need in an example, to cater to the needs of the entire population? If all of them were seeking services, we could not cater to that need, given the resources, the human resources that we currently have. So the World Health Organization for this has a term which is called task sharing, and we go much into this approach, task sharing, in the report, where we talk about who can we share these tasks with, how, and also how it needs to be done in a very logical way, because it's not about simply, taking the tasks and shifting it to somebody else and saying, okay, teach somebody else to do an audiometry or a hearing aid fitting or a surgery or something. It's really about considering what are the steps, or what are the interventions that can be provided by professionals, by healthcare providers who have lower training needs or lower educational needs as compared to a fully trained ENT or an audiologist or a speech language pathologist. So that is the kind of approach that this presents. And as a matter of fact, in consideration or in support of this approach, which WHO strongly promotes, we are launching on World Hearing Day this year a training resource, a training manual, which is for primary level service providers. So these may be general practitioners, or they may be trained health workers and so on. So it is about how to train them in identifying common ear diseases, in identifying hearing loss in the community, addressing those needs which can be addressed in the community, and then referring those that require specialist intervention. So identifying also those who need that specialist care and directing them in the right direction. So we are just going to launch this now, and we will in the coming years also be proposing a service delivery model for hearing aids, which is specifically for resource-limited settings, where services to some people who need these devices can actually be provided without that highly trained, highly specialized human resources that normally provide this care. So we're developing that model, and more about that in the coming months.
It's very exciting, and it's audiology is in an interesting place given its evolution, and having resources and data to support it, like the World Health Organization provides, will get us onto the right path and allow us to meet the needs of of the individuals who are struggling with hearing loss. And before we wrap up here, just a couple of things, if we can. Number one, health literacy is probably a big portfolio component of the World Health Organization, given that you have industrialized countries and then you have third world countries. Can you talk a little bit about the importance of health literacy?
So when you say health literacy, of course, you mean within the general population. That's right?
Correct.
Yeah. So absolutely, I agree that there is health literacy is a big component of the work that we do and what we need to do as well to make sure that the demand side of hearing care is kind of supported and augmented. And yes, it forms a big part of the work that we do. That is why we also observe the World Hearing Day as a part of our campaign to raise awareness on hearing loss, on its prevention, and so on. We also have certain specific initiatives that look at a specific issue. So we have, for example, the Make Listening Safe initiative, which is really about preventing hearing loss, that is, or mitigating the risk of hearing loss that is caused by listening to loud sounds. So, for example, music over your headphones at loud levels or for long periods of time, and also in entertainment venues and so on. And it's a lot about informing people, educating them why this is a risk, what is the risk, how can it be addressed, and also about providing them with the tools. So health literacy is really the core of health promotion, because we need to inform, raise awareness, educate people so as to drive behavior change and to drive those behaviors or those actions that we would like people to have.
So last question that I have is how, if I had a clinic today and I was not doing all of the things I needed to do to increase my awareness of hearing healthcare, to increase the preventative aspects of hearing healthcare, modifiable risk factors and what have you, what would you tell me? What would you tell the average audiologist that the World Health Organization provides in order to help them with these messages?
So thanks for that question. It is my favorite one, because I think whether we are working in a clinic, in a big hospital, or providing services in a community, all of us have to play a role in this effort to raise awareness, to inform, to educate, to make sure that people access services, and also to provide services. So, and I would say that one of the simplest things that we can do as ear and hearing care professionals is really to inform people, not just to address their clinical needs, of course, because that's what we are trained to do, but then also make sure that we raise awareness amongst them about the need for prevention, how to prevent hearing loss, not in their own, when they may already have hearing loss, but also in their families, in their communities, how to become also proponents of those messages. And we can do that very simply in a way by making sure this information is available in clinics. So you could have flyers, you could have posters, banners, you could also have certain, videos and so on playing. And WHO does make these resources available to people. So for example, let's say a parent comes to you with her whole hearing loss, but she's also the parent of a child. If she sees a flyer which includes the milestones of hearing, speech and language development, it may spur her to think, oh, my niece or my child or my neighbor's child doesn't really come up to this, does does not show these milestones, so may encourage that person to bring that child for an examination. And similarly, for it may spur them to think more about why their older adults in their homes or in places that they visit are not engaging so well with them in conversation and so on, and encourage them to bring them to the clinic. So I would say that is the thing that all of us as people working in this field, we can consider doing for sure without too much of additional effort. The other things we could do is really reaching out into the community. So providing care, of course, to the people who come to the clinics. But then what I realized while working in India and what drove me to public health was the realization that the people who actually come to us in clinics, it's the tip of the iceberg. The wider body of the iceberg is really in the community. So, and we have to go out to seek them. So you could have outreach programs, maybe a few times in a year, maybe on World Hearing Day, and if you're so motivated, then a couple of other days. And for those who work also in academic settings and so on, I think it's important for us to also research these aspects, research public health aspects of hearing, and we focus a lot on clinical developments, as we should, not denying the importance of that. But I think it's important for us as clinicians to realize the value of integrating public health into our research, into the teaching and education of the audiologists, of ENTs, and so on, and making sure that we bring this to limelight too. Talk about it in conferences, through interviews or webcasts, podcasts, and so on. So include that public health perspective, both in our clinical work, our research work, and our academic work as well. So sorry that I so long with that message.
No, I think it's an important message to have, and I think it's one that we sometimes overlook because we get so ingrained in the everyday nuances that we sometimes forget that there's an extended group of individuals that could benefit from our help, and we're just not reaching them. So thank you very much. Now, is there anything that I have forgotten that you wanted to add before I close this out?
No, thank you. It's been really nice talking to you. I just have one message. The World Hearing Day is coming up on 3rd of March. Well, it's there now on 3rd of March, and it is observed every year on 3rd of March. As we mentioned previously, we started over 10 years ago, and last time we had about 100 countries and over 500 people in different, so over these 100 countries, 500 organizations organizing activities and events. So I invite you all the viewers and listeners of this webcast to please join this movement and to become a part of this as a way of contributing to global hearing health. Thank you.
Well, thank you so much, Shelly. What we will do is we will make those links and available to the viewers that they can click and go see. And again, thank you so much for your time, for your sharing of information. I learned a lot, and we look forward to having you on down the road. And I really appreciate all of the public health things that the World Health Organization does on a global scale to help individuals, live a better life. So thank you very much.
Thank you to you, Amyn.